Hi everybody, I'm Dr. Dietiker, and for this section of Newborn 101, we're going to talk about fevers in infants. So why is this topic so important? Newborns are born with weak immune systems. They rapidly develop over the first 3 months, but during this time period, they're at the greatest risk for invasive bacterial infections like meningitis and bacteremia, and serious viral infections. This is the time period when children are more at risk than at any other point in their childhood. Fever may be the only presenting symptom or first clue that there may be something more serious going on. So let's back up and do a couple of definitions. So first off, I'm talking about infants that are less than 90 days old for this period. That's less than 3 months old. And as another little fact, infants less than 28 days old are at an even higher risk. Another definition we need to kind of clear the way with is, what do I consider a fever? So a fever is any temperature of 100.4 degrees Fahrenheit or higher. Now, there's lots of different thermometers out there, from ones that use infrared to check your child's temperature by their forehead or in their ear, or even pacifiers that have temperature probes on them. But the gold standard still of a thermometer or taking a temperature is using a rectal thermometer. So what do I want you to do if your child has that 100.4 degree temperature or higher? You need to call and talk to one of the nurses or doctors at Dietiker Pediatrics soon. You really actually need to be seen within a couple of hours, either here or at one of the local emergency rooms. This is actually one of the instances where I don't want you to watch and wait at home. Your child, based off their age and their symptoms, is going to need some series of tests to decide where's the infection or fever coming from. You can call Dietiker Pediatrics, but if for some reason the office isn't open, this is a time that I want you to take your child to the nearest emergency room. So just to summarize and kind of finalize this up, a temperature in a baby less than 90 days old is 100.4 degrees or higher and needs to be seen by a doctor within a couple hours. And if Dietiker Pediatrics isn't open, I want you to take them to the local emergency room. Thanks for joining us for this section of Dietiker Pediatrics Newborn 101.